give a presentation about Barium Swallow. So we are going to talk about Barium Swallow. So we are going to talk about the definition, the indications, contraindications. We talk about the technique. We talk about the common pathologies plus also the contrast that we use. So Barium Swallow, to briefly define it, this is a medical imaging procedure which we use to examine the pharynx and the esophagus, including part of the proximal stomach, after swallowing barium sulfate. So we use barium sulfate because of many factors. First of all, this barium sulfate is radiopaque, meaning that when the patient swallows the barium sulfate, we shall be able to see, if we take our radiograph, we shall be able to see it as a radiopaque fluid lining within the esophagus. So the next reason why we use it is because this barium sulfate is not easily absorbable into the body. Like when you're taking this barium sulfate, it is not absorbed by the body, meaning it will be taken out through the fecal matter after the examination. So we know that using these contrasts, we have contraindications. So before you use that barium sulfate, you have to know that you have to identify and know that your patient doesn't have any suspicion of gastrointestinal perforation. Because if this patient has gastrointestinal perforation, this barium sulfate will leak into the peritoneum, and that will cause peritonitis. Studies have shown that patients that have leakage of barium sulfate into the peritoneum have high risk of developing peritonitis. Then also, if the patient has a high chance of aspirating this barium sulfate, let me say this patient has neurogenic problems like stroke, this patient has very chronic dysphagia, we would rather not use this barium sulfate because it will be aspirated, and it can, studies have shown that it can also cause some blockage. Like it's not toxic to the, remember when aspiration occurs, the contrast will go into the lungs, the bronchi, the primary bronchus and everything. But if it goes there, it can cause blockage of those air, of the alveoli, and that will cause, that will prevent proper gaseous exchange. So another contraindication, if a patient has left-sided colonic obstruction, remember this barium sulfate is made up of, like it's metallic. So when there's an obstruction, we shall see that this barium sulfate will solidify, and it will complicate the what? It will complicate the constipation, like the patient will have some bad constipation. So we have to make sure that we ask this patient if they have any of these risk factors, which we don't want the patient to have before doing the examination. So after introduction, I've talked about the introduction. So we can use a single contrast study or double contrast. So for single, we use barium sulfate alone. Let me give you an example. We use the barium sulfate alone, which is a positive contrast agent, whereby it is radiopaque, and it will make our esophagus radiopaque, as you can see here. Then if you are to use a double contrast, we shall use barium sulfate and also include air, which can be carbon dioxide. So that would give us an appearance like this, whereby we shall have both a positive and negative contrast agent, whereby the barium sulfate is the positive air, or carbon dioxide is the negative contrast agent. So how do we get a double contrast study? How do we prepare the patient, and what do we do to get this? We shall first give the patient the positive contrast, which is barium sulfate. Then we shall also give them effervescent tablets, which produce carbon dioxide, and we shall have a double contrast study. But if you don't have those effervescent Okay. If you don't have those effervescent tablets, you can use air in a way that as you put holes within the straw, such that when the patient is sucking in the contrast, you're able to, as the patient is sucking in the contrast with those holes within the straw, the patient sucks in the contrast with air, and that will give us a double contrasted image, as you can see here. So then I'm going to go to the indications.